and one is ensuring that there are 0 new infections of HIV and AIDS, and the other 0 relates to discrimination, stigma and discrimination, which means 0 stigma and discrimination relating to HIV and AIDS. And the third 0 talks about 0 deaths related to HIV and AIDS. So the emphasis for the next couple of years, it has been a concession that we must concentrate on getting to zeros. So as a country too, we are joining other nations to commemorate World AIDS Day with a particular focus in this particular area. How do we ensure as a country in our national response that there are 0 new infections of HIV and AIDS? How do we ensure that those who are already infected or affected in one way or the other are not stigmatized or discriminated against? How do we ensure that there are no AIDS-related deaths in this country as part of our national response? So for this being the case, the Gambia, alongside other community of nations, would focus particularly in this particular area as part of the 2012 commemoration of World AIDS Day.
Well, well said, Mr. Baji. I will go to Noah. Noah, can you please tell us the history of this World AIDS Day celebrations?
Okay, I guess as Usman alluded to earlier on, HIV has been around for almost 3 decades now. And from the time that the disease was diagnosed, there were a lot of challenges, in terms of, even defining the disease, getting to understand its epidemiology and how it affects, people. But most of the underlying causes of the HIV problem are the HIV-related stigma and discrimination. But of course, globally they felt that, we needed to create a movement around HIV that would attract, the attention of, key stakeholders and partners, including stakeholders at political level, at civil society level. Now, it was not until in 1988, then the HIV program used to be under the leadership of WHO as part of the program that they call the Global AIDS Program. So it was in 1988 that the first World AIDS Day was commemorated globally, and it was a day set aside to really reflect on the achievements that we have made, to identify the challenges, but also to express solidarity, especially trying to remember those that have lost their life as a result of AIDS-related illnesses. As Usman alluded to, this year, and the team was identified since last year, it's getting to zero. These are the global commitment that we have agreed, and they would form the basis of our discussion. December 1st is actually the launching of the World AIDS Day commemoration. After the launching, there should be series of activities, and we would come back to those activities later on.
Wow, thank you very much, Mr. Sisai. Mr. Juf, what is your partake of this AIDS stigma on behalf of this Action AIDS as a stakeholder?
Good evening, viewers. Thank you, Ramatulai. Action Aid is a principal recipient of the Global Fund grant in partnership with NAS, and Action Aid is responsible for the implementation of prevention activities as far as HIV/AIDS is concerned. So our role as an international NGO is to ensure that we provide preventive messages for the general population, and we have come up with different strategies in doing so. For example, we have life skills in schools as one of the activities. This is peer health education as far as HIV/AIDS is concerned in school. We also have it out of school, and for out of school we're using strategies such as stepping stones, STAR, meaning Societies Tackling AIDS Through Rights. And also, we have what we call the Kabilo program, working with communities.
Communities, yeah, the local communities.
So these are some of the strategies that we're using to provide information and education so that we can empower people to make informed decisions as far as HIV/AIDS is concerned.
Okay.
So this is the role that ActionAid is playing in terms of prevention.
Okay. Well, it's well said. Thank you very much, Mr. Dawda Diouf. I'll come to Mr. Usman Ba, who is the program manager at the National AIDS Control. Mr. Ba, how are you working with the public, or let's say with the people who have this illness or virus in them?
Actually, thank you, viewers. First of all, I want to emphasize on these 3 zeros and our role in these 3 zeros. Because when you talk about prevention of new infections, you are talking about trying to provide services that will prevent people from contracting the disease, such as condom provision, like distribution of condoms, prevention of mother-to-child transmission, and offering HIV counseling and testing services to the people, and also trying to manage STIs properly, because STIs also facilitate the transmission of HIV and AIDS by 50%. If somebody with STI, you know, have unprotected sex with somebody with HIV, the chances increases. So syndromic management of STIs is also one of the things that we services that we offer at the facility level. But in terms of the AIDS which is related to the second zero, we try to provide antiretroviral treatment for people who are living with the virus, if we cannot prevent it. But we also give support to people who are living with the virus by providing antiretroviral treatment to those people who are infected with the virus. And then for the third one, we also try to play our part, especially at the facility level, try to make sure that we reduce stigma and discrimination for people living with HIV and AIDS, so that we provide them the best quality services that they require, irrespective of their HIV status. I would also want to talk about what the situation is like in this country, so that people will appreciate that this is a problem. Actually, over the years, we've been seeing the prevalence going up and down, but now it has begun to stabilize. Currently, the prevalence of HIV and AIDS in this country is 1.67% of the population living with the virus. And for HIV2 is 0.07. So people should appreciate that really a lot has been done, and we have actually achieved so many things over the years. And in terms of service delivery, for HTC, we started with 4. Now we have over 40 sites that are providing these services, just to increase access to services. And for the prevention of mother-to-child transmission also, we have over 30 centers that are providing these services. Countrywide. And also for the antiretroviral treatment also, like for those who are infected, for their treatment, we have almost about 10 sites countrywide. So actually, we are actually moving. So that's what I would stop here until later, then I will.
Okay, thank you, Mr. Ba. If you're watching the Gambia Radio and Television Services, this is a panel discussion on National AIDS Day, which is always celebrated every year on the 1st of December. Yes, so Mr. Usman, what are your challenges, the challenges you're facing since the inspection of your office here in the Gambia?
Not specific to my office per se, but in the national response probably. You know, it has not been easy. We have made mention of the 3 zeros, and most of the challenges are around those areas where the theme for this year and for the next 2-3 years is focusing on. Stigma and discrimination is one big challenge that the national response continue to face. And here, because it is not something, it's something that is coming from the public, and even from among people who are intended to be service providers. So if you have people who are infected or affected by the disease and they are discriminated against, they hardly come up